Israel's continued bombardment of Gaza's health facilities has resulted in the healthcare system practically collapsing. Gaza's health ministry says it's detected about 1 million cases of infectious diseases, describing the situation in the Strip as extremely catastrophic. 350,000 chronic patients are at risk because of non-administration of medications. Another 60,000 pregnant women in Gaza are in danger because of a lack of access to health care. And around 10,000 cancer patients are at risk of death. Meanwhile, a UN team has delivered essential medical supplies to hospitals in northern Gaza for the first time since the war began in October. The situation there is described as grim, with severe levels of malnutrition, children dying of starvation, serious shortages of fuel, food and medical supplies. The UN spokesperson, Stéphane Dujarric, gave this update.
A team made up of World Health Organization, the Office of the Coordination of Humanitarian Affairs, UNICEF, and the UN Population Fund all visited the Al-Auda and Kamal Adwan hospitals in northern Gaza yesterday. They did that to deliver fuel and essential medical supplies. The visits were the first to those specific hospitals since early October, despite our ongoing efforts to gain more regular access to the north of Gaza. The team delivered 9,500 liters of fuel to each of those hospitals, but as you can imagine, this is just a fraction of what is actually needed. The Director General of the World Health Organization, Dr. Tedros, spoke of, quote, grim findings during the team's visits, including several levels of malnutrition, children dying of starvation, hospital buildings destroyed, and serious shortages of fuel and food and medical supplies. The Kamal Adwan Hospital is the only pediatric hospital in northern Gaza, and it is, as you can imagine, being overwhelmed with patients. Dr. Tedros said the lack of electricity poses a serious threat to patient care, and the lack of food led to the death of 10 children, as the WHO team was informed by doctors at the hospital.
Well, let's speak to Dr. Yipeng Ge, who's a Canadian medic who spent a week treating patients inside Gaza, and he's in close contact with colleagues in the Strip and is joining us live from Ottawa on this news hour. Thank you so much for being with us, Doctor. You've been speaking to your colleagues in Gaza. What are they telling you about the current situation, especially when it comes to these infectious diseases? 1 million cases. That's a staggering figure.
That's right. I mean, thank you for having me. The numbers are staggering, but I think the human cost of what's happening on the ground, the individual lives that are being impacted by not only the infectious disease and the continued violence that people are experiencing, but also I think it's really important to highlight the attacks on healthcare that have since continued. I had to check on the status of my colleagues and friends who are healthcare workers in the Gaza Strip to see if they are still alive. Only in the past 2 days, I had to check in to see if my colleagues at the Emirati maternity hospital to see if they were alive, because the gates of that hospital was struck by a drone strike that killed a paramedic on duty. It killed a nurse. A total of 11 people, and over 50 people were harmed and injured, including young children.
Yeah.
And with the continued attacks on healthcare, people do not feel safe to provide that kind of care, but they're still doing the essential care of looking after their patients and their community. It's just horrendous.
It is. Many healthcare workers have indeed been killed in this war. And that makes it really difficult, as you say, for them to treat people who are suffering. I just wanted to ask you a bit more about the infectious diseases and these 1 million cases. What sort of diseases are we talking about here, and what's caused them?
I mean, with the overlapping food and clean water and housing insecurity, that has pretty much left no one every single person has been entirely touched by those overlapping crises of food and water and shelter insecurity. It has led to the conditions of overcrowding, displacement with people living in tents, improper sanitation and clean water, to the point where we're seeing so much communicable disease in that of respiratory infections, gastrointestinal disease, including a major outbreak of hepatitis A. And these are preventable infections and diseases that can also be vaccinated against.
Right.
And to heal from such things, we need nutritious food, we need clean water, and without such things, we're seeing the worst of the worst with not only these communicable diseases, these infections, which are entirely preventable and also treatable,
Right.
and we can't even treat them because of the lack of medications, lack of antibiotics, as you've already said.
Dr. G, well, we also have children dying of malnutrition, especially in northern Gaza. And this is happening at an extremely alarming rate. There are the deaths, of course, but there are also long-term consequences to these children not getting the proper nutrition they need.
You know, one of the children that I saw was the sickest child that I've ever seen in my entire medical career. They were carried in by his mother and wasn't able to walk anymore because of how malnourished he was. And I could wrap my index finger and my thumb entirely around both the upper arm and the lower leg of this child. And he was 9, 10 years old. And I'm worried that this is one of the children that have already died since I met him 2 weeks ago. And the number of children have died from severe malnutrition is now in the double digits. These are entirely preventable deaths. And these are children we're talking about that are suffer the most serious consequences from the ongoing genocide and assault by Israel on the people of Gaza.
Thank you so much for talking to us, Dr. Yipeng Ge, joining us there from Ottawa in Canada. Thank you for your time.
Thank you for having me.